Mid-stage total and unicompartmental knee replacement exercises. When the early stage exercises have become easier and feel comfortable, progress onto the mid-stage program. If you are unable to complete these exercises in one go, you can break them up. It is normal to feel ready for the mid-stage program around 2 to 3 weeks after surgery. Static quadriceps. Lie with your legs straight. Place a small rolled towel under your knees. Pull your toes up towards you and push your knees firmly down into the towel, tightening your thigh muscle. Hold for between 5 to 10 seconds. Perform 1 to 3 sets of between 12 to 20 repetitions, once per day. Double leg bridging. Lie on your back with your hips and knees bent, feet flat on the floor or bed, and your feet hip width apart. Lift your hips up and then slowly lower back to the start position. Perform 12 to 20 of these as able and 3 sets, once per day. Double leg bridge with alternate heel lifts. Lie on your back with your hips and knees bent, feet flat on the floor or bed, and your feet hip width apart. Slowly lift your hips up and hold, maintaining a still and level pelvis. Slowly de-weight one heel and hold. Keep your pelvis lifted and swap legs. Hold this position for between 5 to 10 seconds as able, and perform 12 repetitions on each leg, once per day. The clam. Lie on your side with your hips and knees bent. Keep your feet together. Lift your upper knee. Slowly lower the knee back to the start position. Feel the exercise around the outside of your uppermost hip. Perform 10 repetitions and 3 cycles of this, once per day. Side-lying hip abduction with a static hold. Lie on your side with your legs out straight. Lift your top leg up and out to the side and hold. And return to the start position. Perform 10 repetitions and 3 cycles of this, once per day. Hanging knee extension. Place a rolled up towel under the heel of your affected leg and let your leg relax into the space below your knee. Feel the stretch at the back of your knee. Let your knee straighten fully. Hold this position for a total of 5 minutes, once, twice per day. Static exercise bike. If you feel confident and you have access to a static bicycle, you can cycle for between 5 to 10 minutes on low resistance for 3 days per week. We advise that you adjust the height of the saddle so that you feel comfortable. Knee bends. In a seated position, place your foot on the floor and slide your leg back as far as you can before you start to feel discomfort. Use your other foot to ease the knee into a little more bend. Hold this position for a total of 5 to 10 seconds and repeat 3 times. Repeat this 2 to 3 times per day. Sit to stands. Move to the edge of your chair, feet hip width apart. Use your legs to push up into standing. Use your hands as little as possible. Slowly lower back down to the chair using your legs. Perform 1 to 3 sets of between 10 to 20 repetitions as comfortable, once per day. Progress this exercise by positioning your arms out straight while moving from sit to stand. Progress to the next level by crossing your arms across your chest and then moving from sit to stand. Heel raises in standing. Stand with your fingers resting on a wall or table for balance, feet parallel. Feet turned out. Lift your heels off the ground to full height and slowly lower back to your start position. Perform 3 sets of between 12 to 20 repetitions, once per day. Knee bends. Facing a step, place your operated leg onto the step. Push forwards, bending your knee as far as you can. Try to take your operated knee over your toes, keeping both heels down, and return to the start position. Hold the bend for a total of 20 seconds and repeat 1 to 3 times, once per day. Facing the step, Step up using your operated leg. Slowly step down again, leading with your unoperated leg. Perform this exercise for a total of 2 minutes, once per day. Mini sumo squat. Stand with your fingers on a table for balance. Feet apart and turned out. Stick your bottom out as you descend. Only descend a small distance. Perform 2 to 3 sets of 12 repetitions once per day. Wall squats. Stand with your feet a comfortable distance away from the wall and hip width apart. Lean your back against the wall and slide down, bending your knees. Descend a comfortable and safe distance and then return to your start position. Perform 1 to 3 sets of between 12 to 20 repetitions once per day.